I'm Anaisa Cunha, and I will be arguing why euthanasia and physician-assisted suicide should be legalized in the United States. So just an overview of what we will be discussing today. We're going to define and discuss what euthanasia and physician-assisted suicide actually is, what the issue is regarding the topic, who this involves, where it is already legalized and how it affects us, and why overall we should legalize euthanasia and physician-assisted suicide. So to grasp a better understanding, I will define what euthanasia and physician-assisted suicide is. In Merriam-Webster's dictionary, euthanasia is actually defined as the act or practice of killing or permitting the death of hopelessly sick or injured individuals in a relatively painless way for reasons of mercy. If you were to break this down, it could be broken down into two forms as active or passive. Active is directly or deliberately causing the patient's death. An example of this would be overdosing on painkillers in the hospice setting. And for passive, this is an indirect death, withdrawing or withholding treatment. An example of this would be turning off some sort of life support machine. So if someone was hooked up to a machine that was helping them breathe, and it was turned off, resulting in the patient's death, that would be a form of passive euthanasia. You also have to take into consideration of voluntary and involuntary euthanasia. This would include, for voluntary, the patient is actually conscious and capable of making decisions, whereas involuntary, the patient is unconscious, too young, or in some cases, if they have some sort of illness and it alters mental capacity, that would be a form of involuntary. And then you have physician-assisted suicide. The definition for that, again, by Merriam-Webster, it is suicide by a patient facilitated by means such as a drug prescription or by information, such as indication of a lethal dosage, provided by a physician aware of the patient's intent. So this is more the specified physician-assisted suicide, exactly what it means. So we have a big question. What is the issue surrounding this topic? The big argument is whether or not this procedure should be legalized, because ultimately it is viewed as a murder of life, and life is considered precious, so why are we allowing this opportunity for people to kill themselves? So one of the earlier instances was in the 90s with Dr. Jack Kevorkian, when he used an invention to actually help a woman commit suicide. In an interview, he said that this had to do with personal autonomy, feeling that a patient had the right to make this decision if they were terminally ill. He also felt that as a physician, they should use their medical expertise combined with logic and common sense to decipher if it's medically justifiable to go along with it and feel that it was ethically correct. And overall, he thought that it was the physician's duty to at least have this option offered to his patients that were terminally ill and in pain. So, again, we're discussing why is this such a big issue. It is because it is viewed as killing a person or helping someone kill themselves. And though this is viewed negatively, I feel like it is maybe a little bit taken out of context if you haven't really chosen to dig a little bit deeper into the situation. So that's what we're going to do. We next have to discuss those involved in the situation. So overall, those that will be receiving the procedure are those terminally ill patients. These terminal illnesses could include cancer, heart failure, chronic lung issues, kidney disease, stroke, AIDS, dementia, but more specifically, someone that has been given a time frame of when they are going to die. So they have been diagnosed with this terminal illness and been given that 3 to 6 month time frame of when they're expected to live and when that cancer or disease is going to take over their body. We next have the family and friends and loved ones, the supporters, as well as the healthcare staff such as the doctors and nurses. And when discussing a topic as big as this, it is very crucial to take into consideration the perspective. So really empathizing from each standpoint. More specifically, putting yourself in the shoes of the patient. You have to think, you're that terminally ill patient. You've been given this time frame. How would you react? How would you feel about at least having that option, knowing that you don't have to die the way that the doctor describes, the cancer taking over your body, the pain, the fuzziness from all the medication, and just the overall experience. You can totally prevent that and, say goodbye, do what you want to do on your bucket list, die peacefully, and be able to say goodbye in a way that that benefits you, to say goodbye to everyone that you want in the manner that you want. You next have to empathize with the family. Would you want to stay there, being there with your mom, sister, grandma, watching them go through this experience and in pain, and just being so grateful when that time finally comes for them to die, because they won't be in that pain or have to be, going through that anymore. And then next you have to take into consideration the doctor's perspective. So how might you feel that as a doctor, having this option for your patient instead of having them just stay in that hospital bed all day? As a nurse, you have to consider their standpoint. They're the ones taking care of them, trying their hardest to make that patient as comfortable as possible, providing the best necessary care available. We are next going to discuss where euthanasia and physician-assisted suicide is actually legal. So currently in America, euthanasia is not legalized at all, although physician-assisted suicide is, but only in 8 states. This includes Oregon, Washington, Montana, Vermont, California, D.C., Colorado, and Hawaii. Now, no one could just come in and say, hey, I want to do physician-assisted suicide, can you help me out? No, they have to go through specified prerequisites that include being the age of 18 or older, having, for example, a life expected death time of 6 months or less. You have to have multiple psych evaluations, multiple doctor verifications, as well as being educated on alternatives such as palliative care, hospice care, pain management, and all of those. So it's not an easy process. You also have 36 states that have laws prohibiting assisted suicide, as well as 3 prohibiting by common law, and 4 that have no specified laws regarding the subject in the United States. We next look globally, and there are actually, according to the procon.org, there are 9 countries in the world that allow either euthanasia or physician-assisted suicide. These include, but are not limited to, Belgium, Canada, Colombia, Finland, Germany, Luxembourg, the Netherlands, and Switzerland. So these are not just the entire countries that agree with them. Like the United States, there are only some parts. So some of them agree, some of them don't. And what we can learn from these is that how it affects us, I guess I could say, is that we can study how they have been going about this process and kind of learning, what works, what doesn't work, how we can make it effective and safe for Americans, and how we can make it a steadier process for us here in the United States. So now that we've kind of grasped a deeper understanding and a little bit more education on the subject, we will discuss why euthanasia and physician-assisted suicide should be legalized and the benefits. So first of all, this allows a terminally ill patient the opportunity to decide how they wish to die. So if they do go through with it, they can set a time, they can go travel, do what they want to do, see what they want to see, and say goodbye to their loved ones in the way that they wish to and just die peacefully. Next, they have the right to refuse. So no patient that is provided this option, if they don't want to, they can go by another means of their end stage. So they can go to hospice or palliative care. They don't have to go through with euthanasia or physician-assisted suicide. They can say no. They have that right. Another thing is just by allowing the opportunity can give patients more motivation to not go through with it. In a new study, 50% of people that filled their prescription didn't actually end up going through with the suicide. 50% of those terminally ill patients had the opportunity to, but chose not to. We next have a decreased risk of patients trying to commit suicide on their own, so feeling that they have no other options and are not provided that physician-assisted suicide. Though this number is very low, in a study it was as low as 2 to 3%, but that is still 2 to 3% of terminally ill patients feeling that they have no other choice but to try and commit suicide on their own. You next have this opportunity allows people to seek medical help through those prerequisites. So through the therapy and having to see multiple doctors can actually be beneficial to the patient, though they may not go through with the physician-assisted suicide. They can actually get help in other areas that they may not have realized they needed. And lastly, the cost is cheaper. Unfortunately, in this financial seeking world, one of the benefits to this is that the cost is much cheaper, reducing any kind of financial pressure that the family may feel, especially during this fragile time of the end state. Nobody wants to think of the financial side of it, but unfortunately in this world that we live in, it is a thing. So after taking all of this into consideration and starting from one of the first points that I made, looking from other people's perspectives, I found this woman, Miss Eva Thompson. She was a metastatic colon cancer survivor, but she ended up getting the cancer again. She was actually given 1 year to live and actually wrote a letter to her government trying to raise awareness for this, to legalize euthanasia and physician-assisted suicide in her state. Her statements included, quote, "Some object to medical aid in dying, often calling it suicide, but they are wrong. I am anything but suicidal, and it would be unfair to label me as such. I am only 55 years old, and I have so much more I want to do. Aid in dying takes a horrible situation and makes it just a little gentler. It would provide me with less fear, greater peace of mind, and a measure of comfort knowing that if things got too bad, there was another option to die humanely. What's more, I believe that just having the option of aid in dying would give me greater physical and emotional strength to keep going and endure more and actually help me to live longer." Now, I just want you to think about this from the standpoint of an actual terminally ill patient and just kind of her view on it and how she sees it. So just finishing up here, yes, euthanasia and physician-assisted suicide should be legalized. No one is immune to receiving a terminal illness. As we must empathize with those that do, we must legalize this and have it provided as an option, not to advertise it, not to be shoving it down people's throats saying that this is the number one option. No, we just need to have it as a sort of safe point for those people. They don't have to take it. They have every right to refuse, but just having that option can make a world of difference. I hope if you have taken anything at all from this, it's that even if your opinion didn't change, hopefully you have a better perspective as to the people involved, what they're feeling, and why this topic should at least be considered for the terminally ill, so that they don't have to die suffering. They do what they want to do, say goodbye to family, and get to die peacefully with dignity, because that's all we could ever want for people, to just have a peaceful death.